Welcome to Podcasts on Demand, a continuing medical education activity. This activity includes the most recent and current clinical data presented by leading experts. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the podcast description that can direct you to this information.
Hi, this is Dr. Doug Dieterich. I'm a professor of medicine, the Icahn School of Medicine at Mount Sinai, and director of the Institute for Liver Medicine, the Mount Sinai Health System. And I'm here today with a patient with PBC who has an interesting story to tell. Okay, before your diagnosis of PBC, what symptoms were you experiencing?
So actually, I wasn't experiencing any physical symptoms. I wasn't in pain. I went to my neurologist and he did a blood workup and he saw that one of my levels wasn't quite right, and he made a referral to you. So it was actually very low drama.
Yeah, it's really interesting. Around the metropolitan area, all of my colleagues report something very similar, and that we, none of our patients seem to be itchy. Because that's usually the main diagnostic criteria for PBC are itchiness and fatigue, and it seems to be more common elsewhere in the U.S. than in the metropolitan area. But you had abnormal liver tests, which were uh, suggestive of a cholestatic uh, type liver disease, which means the bile is backing up a little bit. We expanded the blood tests to include the AMA, um, the anti-mitochondrial antibody, and along with the alkaline phosphatase elevation and the GGT, um, that made the diagnosis and made a liver biopsy unnecessary, which was good for all, because that's you need like two of the three criteria, including liver biopsy, elevated liver enzymes, and a positive AMA. So all we had two out of the three. We had the AMA, ALK phos, and GGT elevation.
Right. And then I believe a year later, we actually did do the biopsy.
Yeah,
Yeah.
yeah, to prove it, and we proved it. Was anything else going on? Any super stressors? Any other things any other trigger that you can point out to the onset of the PBC?
There really wasn't. I was thinking about this before we started to record, and there really wasn't. It was basically a typical yearly appointment, and I was actually surprised. And then I got referred to you, and then we started kind of going down the path. So there's nothing that I can point to, nothing specific.
Yeah, it's hard to it's often just the age. You fall into the typical, um, you know, female of a certain age, um, which is 90% of the population with PBC now, or 95. It used to be 95. It seems to be there's more men being diagnosed now. I'm not sure if that's because we're more sensitive to it, or or whatever. I think the question um, sometimes is asked, because some people say, "Why, why did I get this?" And we have, it seems there's some genetic component, some genetic autoimmune component, because I have a family where three generations have it, for instance. But um, so there's a a nature a nature part, and then there's a nurture part, and some people think there are triggers like a viral infection or a serious illness. And in one study from our colleagues at Mount Sinai, that showed living in proximity to a landfill, like in Staten Island or New Jersey, was also a significant factor in triggering, PBC. So if you have the genes and you're exposed to some chemical or something, then it triggers the disease to kick off. So that's that's kind of what we're thinking now, although no one really knows about autoimmune diseases and why they start.
Well, what's interesting to me is that when I was pregnant, I had a cesarean section, and then a year later, I had my colon taken out. So I have an ileostomy. So I spent a lot of time with those doctors kind of in that area, and this never came up. And the doctor that I did my yearly appointment with was my neurologist, and he was the one who actually referred me to.
So that's how you learned about having PBC because we did the testing, um,
Exactly.
and confirmed it.
I was to say, and there's something about tests that gets rid of the ambiguity. Like I actually liked taking the test with you. It made me feel good. I was like, okay, we have it, and now we can go forward.
Yeah,
Versus
yeah,
kind
yeah,
of this gray area of, wait, I think you have it. So it felt good.
yeah,
Even yeah. So
yeah. No, I think that's very rational, thinking. Frankly, it's good to have a solid diagnosis and be confident about it, because there are plenty of people who were in doubt about things, or they have two diseases, or um, they have overlap syndrome, which happens a lot in PBC, overlap with autoimmune hepatitis. So they have both. And we have to treat them with like two different diseases. Um, so you talked about interactions with your healthcare provider, your neurologist, and ease of access. I don't know. Did you have trouble getting an appointment?
I didn't. I think I'm not sure if my neurologist actually knows you or not, but I think he's in the Mount Sinai health system, and he spoke very highly of you. I got on your calendar, and then I just took it from there. So it wasn't really difficult.
What did this diagnosis mean to you? Did you go to Dr. Google and
Okay. Okay. I tried not to. So I try to have, and this is, I don't always follow my own advice, but I try not to Google anything about health or finance because it just gets you down a rabbit hole. I did tell my mom about it, and she did the Google and she did the research, and she said you're going to be fine, and here's my diagnosis. But then that was about it. I just didn't. I trusted you to kind of, you're a doctor, you know a lot more than I do, and I didn't want to worry myself, if that makes any sense. Like it didn't make like there's nothing I could do, right? And I felt like you were the liver doctor. I felt like I was probably the most boring patient you'd ever seen, which was fine by me. And I thought, if you can handle this, then I don't need to know more. But that's just my personal. That was just my personal,
Yeah.
kind
Well,
of.
it's partly helped by the name change, that we changed the name um, a few years ago from primary biliary cirrhosis to primary
Oh,
biliary cholangitis. And
wow.
when it used to be named primary biliary cirrhosis, it obviously got people really upset right away if they were given the name of the disease. Um, but fortunately, the name was changed. And the interesting history about that, why they called it that, was that it was really first described by the Mayo Clinic in Minnesota, in Rochester, Minnesota, because it's a very high prevalence in Scandinavians, people of Northern European um, background. Northern Minnesota is populated by Scandinavians, and so these tough Norwegian and Swedish farm wives would not go to the doctor, to not go to the Mayo Clinic, until they already had cirrhosis and were jaundiced and itchy and in really bad shape. So they assumed that everybody who had this disease had cirrhosis. So that's how they first saw it. But now that we have more sensitive blood tests, um, we can we can make the diagnosis long before that, and hopefully head off those difficult complications. So did you start treatment at the time of your diagnosis?
So yeah, I think I peppered you with questions. I think I peppered you with all the questions, like, what did I do wrong? Is this hereditary? And I think basically you answered the questions of like, no, this is nothing I did. This is just something that happened. And I believe you put me on a drug, um, and and then I think we took it from there. I think that was the first time you put me on one drug or stuff, and then which was fine, and there was no, I wasn't allergic to it. It was perfectly fine. I actually forgot I was taking it. And then I just kind of saw you, and then I think we upped I think you upped the dosage. And
Yeah.
again, no, there were no problems there. Again, like I didn't, this was all basically you doing kind of like the numbers crunching. I felt no different. If that makes any sense. I just took another pill.
Yeah.
And then I think after the biopsy, I think we upped it again. And I think just recently, maybe 2 months ago, you introduced the new medication.
Yeah, because your numbers were still not normal. Um,
Right.
right. And we had that little worry about the PSC, the other disease that goes along with ulcerative colitis, um, which is much harder to treat. So yeah, I think you mentioned how easy it was to incorporate your medication into your
Yeah.
life.
Yeah.
Um,
Yeah.
any side effects? I guess you said no.
Yeah, no, there weren't any, which was great. I mean, your office was great. They would email me and say, are there side effects? I would kind of forget I took it. So yeah, I just it became a routine. Like I take vitamins, I take this, so it was not a big deal.
And you mentioned incorporating medication into your life was not a big deal. So
Yeah.
that was easy. No side effect.
Yes. Yeah,
Uh,
no side effects. I have a I don't know if this is good or bad, but I have a very structured routine in the morning. And the first thing I do is obviously brush my teeth, etc. But then I take my vitamins and this I just added this to that. So it was
yeah,
pretty easy.
that's great. Yeah, it makes it easy that way. And then, well, I think we talked about switching because your liver enzymes. The official number is 1.67 over the upper limit of normal for the ALK phos. Has a significant impact on um, liver transplant-free survival. Um, but if we can normalize the ALK phos and the GGT, then it actually increases um, those increases those numbers dramatically. So the more normal it is, the better the prognosis. Did you have any concerns about that?
No, I mean it was just get another pill. So basically like the vitamin, the Ursodol, and then this new one. So it just kind of added it to the routine. And I think I've been on it for about a month and a half maybe or so, and no side effects. So no real problems there.
Yeah, there's very very low side effect profile for this medication, which is great.
Mhm.
Um, have you had any other health issues?
No, actually no, nothing.
Okay. And any what are the key learning experiences in your journey with PBC?
I was thinking about this before we got on the podcast. I feel like I feel like you're doing all the hard work, and this is very easy for me, if that makes any sense. So I think I think the key is just basically, either getting that checkup earlier and listening, or just, like right now, I was not on a good routine with my primary care physician taking an annual checkup, right? So I have done that. So that's one step I've taken. So like if I had done that, maybe I would have met you earlier. But other than that, I mean, I don't know what else I could have done.
Yeah, well, I don't think there's really any real damage, to your liver. So I think we're still doing okay.
Mhm.
Um, any thoughts about looking forward? Anything else that's on your mind about the long-term prognosis?
I mean, it would be, in an ideal world, right? You'd call me one day and say, you know what, you don't need to take these drugs anymore and everything's solved. But I know that that's kind of a fantasy. So I'm okay with taking, these drugs and making sure that things are under control. So I don't have any anxiety because I know that it's controlled. So and I know that I don't have false hope where it's going to be there's going to be one day where you say stop taking the meds. So I'm kind of at peace with it, if that makes any sense. So I know there's a problem. I know there's a solution. It seems very logical to me. There's no side effects, so I'm pretty happy, if that makes sense. I don't know if that. I
That's
mean, like
great.
that's very. I mean, that to me, that's the best outcome. You
Yeah,
know, it's not
yeah,
terminal. It's chronic, not terminal, and that to me is a very big difference.
yeah,
So
right. It's totally treatable,
yeah,
um, which is great. And then we were happy to get this new medication in time to prevent any liver damage. So that's really all.
sure. I guess
Uh,
the one thing I'll say is I went to the dentist the other day, and they said, "Are you taking any new medications?" And I introduced this one. I had to tell them about this one, and they were kind of inquisitive, like, "What's it for?" And it's not in our chart, it's not in our system. So I felt kind of like a newbie, and I said, "Well, it's just been approved." I felt kind of awkward, but it's fine. And they thought it was very cool, by the way. They thought it was they thought, "Wow, you're taking this new drug. That's great. We haven't heard about it. And they immediately Googled it. They were interested. So.
Well, good. I'm glad they're taking such good care of you too. And thank you all for joining us for this podcast. I hope you learned about PBC and its treatment and the patient's perspective.
We hope you found this podcast useful and educational. To receive continuing education credit and to download your printable certificate, please go to the activity page at practice.cme.com to complete the post-test and evaluation to receive continuing education credit.